Hey guys, how are y'all doing tonight? I did open a question queue, so we have a guest tonight. This is Sarah Sawyer, and we are going to be talking about ADHD and gaming and a little bit of mental health and a little bit of this and a little bit of that. So welcome on in. If you've been here before, you kind of know the drill. I've disabled, actually I better disable sound commands. Oh no, they are disabled. Look, I did something right that time. I've disabled sound commands because we have a guest. And some of them are questionable.
No judgment.
Yeah, and I am super excited to hopefully be able to caption both sides of our conversation for the very first time. I am going to refresh this, and hopefully that will work. So we are blessed to have today Dr. Sarah Sawyer. She is a doctor of counseling psychology and licensed mental health counselor, working as a private practice associate clinician with Sound Psychotherapy and Assessment in Seattle, Washington. I'm going to hit you guys with a bunch of links here in just a minute. Hey, Gamer Doc, thank you for that follow. I appreciate that. In her practice, she specializes in geek, LGBTQ+, and identity work with clients. She also serves as a content manager for Take This, a mental health nonprofit that seeks to educate and advocate for mental health support in the gaming community and industry, who I am a huge fan of, by the way. Sarah serves as a founding member of the advisory board of Leyline, the first geek therapy certification program. She has been featured in Variety and I Thrive Games, multiple streams and podcasts, and an MST3K style commercial for the popular indie game Death Squared. Sarah streams weekly on Thuppence and records the Brain Noodles podcast for Geeks Like Us, a nonprofit that strives to embrace geek culture and encourages the development of science and new ideas. She regularly travels to present about video games, geek culture, and psychology at conventions, as well as being a contributing author to the first ever positive psychology book edited by Dr. Rachel Cohort. So thank you. Hey, you've got the book right there. Okay, I'm about to hit y'all with a link wall. Hey, Ink Attack, how are you? Oh, wait. Link Attack? No, I don't know. I don't remember.
Ink Attack.
I think I know this. I feel like I know this.
Oh, Fusro Doc.
There you go.
Hi.
What? Yeah, Link. There we go. Yes. I remembered. Sort of. I remembered eventually. So first of all, Sarah, thank you so much for being here today with us. I appreciate you agreeing to come on here.
Of course.
We will open up with what I always say is either the easiest or one of the hardest questions of the night, and that is, why do you do what you do?
Because I like to keep things interesting. I guess as a true therapist, I'll follow your question with a question. Which thing that I do as to why I do it?
That is a good question because you are super busy.
I am.
I guess
if the question is why do I stay busy, then it's because I like my life at that frequency. I do better with plate full than empty.
Understand that. What made you interested in mental health, generally speaking?
Oh, unfortunately, my answer is a bit morbid. So talk about first impressions for the crowd. But in junior high, I think I was part of a positive role models program. And I wanted to know what made people tick, and I wanted to know why positive role models were important and why people do what we do, because I had a friend who took his own life, and I just wanted to know where that stuff comes from. Like, why do humans do the weird things we do? Why do we eat the way we do? Why does my brother chew with his mouth open? So, and then I had a really awesome psychology teacher in high school that teed things right off for me, so.
Yeah, that's,
yes.
I found that there are a lot of mental health professionals who have a backstory that's kind of similar. Something happened or something, interested them that was not necessarily something super light. And the thing that I love about this kind of story is that you wanted to do something about it. Like, there are a lot of people who say, oh, this terrible thing happened, and everyone should go through the same thing because I had to experience it. And then there are the people who are the opposite, and they're like, no, this terrible thing happened. I want to understand it so I can help others through it. So I think that's actually beautiful. I think that's a beautiful backstory. from your long list of things that you love to do, gaming is clearly a passion of yours. Do you have a favorite game or one that you just can't quit?
That really depends on the day. Right now, I'm really vibing hard with Stardew Valley. I went to PAX East, and I, with another friend, introduced a mutual friend. This is really vague. Basically, we were talking to a friend about trying Stardew Valley and how awesome it is. And so after that, I was like, I have to play this again. And so I started it on my Switch. But if you're asking for my favorite game of all time, I would say it's the BioShock series.
Okay.
Interesting. I like the mechanics and the story is decent, but also neo-dystopian. So that's kind of the vibe I go for.
Yeah. Yeah, I have, I play RuneScape, which is not super popular, but it's the game that just won't let go. So yeah.
I will also argue that Fusardak, who's a very dear friend and colleague, he actually snuck in. He's an author in the Video Games and Wellbeing book, and he's a co-streamer on Thuppence with me on Geeks Like Us. But he's right that Viva Pinata is probably like my ultimate favorite game of all time.
Okay, what is Viva Pinata?
Oh, a very underrated, incredibly satisfying game on the Xbox 360. You can play it on the Rare Replay on more recent consoles. But it's a game where you're a gardener. You never see yourself. So you just see your tools floating like a Wii game kind of. But you have to fix up your garden. It's been abandoned by this old man who is too tired to do it, but he guides you through. And you clean up your garden. And as you do, entirely pun-based animal piñatas that start out as black and white enter your garden. And if you have the right plants and decorations, they will become your residents. And then as you continue with the game, of course, they complicate in what it's required. So like Auroreo, the lion, requires like donuts, which are deer, and they require like, I forget the name for zebras, and they require another thing, or like it's just absurd, but it's so fun. The music is award-winning, and the progression of day to night, the mechanics are really beautiful. So I just love, that's my like comfort game.
Yeah. Okay, well, if it's pun-based, I mean, I wrote it down, so you'll see me writing in this little notebook that is now filled with stuff that I have to go back and try out. But you'll see me writing stuff down. But this is one that, if it's pun-based, I love jokes. I love puns. I post a pun almost every day. So
oh my gosh, it's so cute. And then the other day, because I follow Rare on Twitter, because I'm a big stan for Rare, they said that they had each employee come in, and each employee from their studio, none of them are voice actors, but they all came in and were the voice of each animal. Like each of them got an animal and they just made it up on the spot just to be silly. And I can't help but love that.
Yeah, that's really cute. Pinata-based ecosystems in your backyard. That is awesome.
That's it.
That's great.
Yes.
Do you have a serial killer or true crime story that fascinates you? And I asked this because my very first guest on my show, it came out like randomly during the show that she was this huge true crime serial killer fanatic. And I was like, wow, what an interesting thing. And so the next time I had another interview with someone, in the middle of the interview, somehow we found out that she also had a serial killer that just fascinated her. So now I just ask people, do you have a true crime story that fascinates you?
Interesting. I'm sure there's a study out there about how psych folks have very dark taste in media, because my favorite show is Black Mirror. But I mean, not one in particular that I like the most. But if I didn't go into geek and video gaming for my specialty, it was going to be serial killers, and I was basically going to do what they did in Mindhunter without knowing they were going to do that in Mindhunter.
Yeah.
So that was a big career fork that I chose a very different path. But I guess maybe Ted Bundy, because he's from here.
Mm-hmm. Yeah.
If I had to pick one.
Yeah. That's Mindhunter's a great show.
Yeah. Oh yeah. Good one.
That last season ending, I don't know, I'm not going to spoil it because I don't know if anybody watches it or they're going to watch it, but that last season ending, I was just going, okay, hang on. But it was great. All right. So our topic tonight is ADHD. And we are going to talk a little bit about ADHD and kind of gaming. So if anybody has any questions about ADHD or anything like that, again,
Yes.
exclamation point Q. We'll get a question into the queue. I'm also watching chat. So if you ask something in the chat, oh, there's a puppy.
This is Atlas. He was a therapy dog failure, so he's just now living the good life at home.
Just a good boy. Yes.
Yeah. He only likes his people. Everybody else he needs to warm up.
Yeah.
But he's a sweetie.
Well, he looks very cute. He's very adorable. Can you just give us a general overview of ADHD and what it is?
Sure. So, ADHD as a disorder.
Oh, I think we might have lost you. Hang on a second.
Uh-oh.
Oh, wait.
Can you hear me now?
I heard you again. Yes.
Am I here now?
Yes, you're here now. Okay. I think you're back.
I think the internet said we have to talk about Viva Pinata more.
We do. We have to talk about Viva Pinata again.
Okay, so there's generally 3 flavors. Inattentive, hyperactive, or combined. And then when we think about ADHD as an acronym, it does technically have the word hyperactive in it, but there is no more difference between ADD and ADHD anymore. Is it?
Yeah, I think we're good. Yeah, I think we're good.
Oh, okay. And so then I just had to check because then I was like,
okay.
Can everyone hear me?
Yes, we can definitely hear you.
Okay, perfect. So then if we're talking about, like, I'm sure for the viewers that are return watchers, you've heard what the DSM is, but just in case, the DSM is the Diagnostic Statistical Manual of disorders that we use when we come up with clinical diagnoses. And it's a big old book full of a bunch of lists of symptoms. And so you have to have symptoms from both camps, but then you can have more inattentive symptoms. You can have more hyperactive symptoms. But basically, it looks something like, both for children and adults, symptoms can vary between, like, struggling to pay close attention to details, making careless mistakes on schoolwork or on work tasks, on chores, struggling to listen when being spoken to directly, struggling to pay attention on an ongoing basis when you're doing the same task, especially when it's perceived as boring to the person, struggling on following through with instructions or failing to finish tasks all the way. Classically, difficulty organizing. Although as a person with ADHD myself, organizing is like my favorite thing to do. So that's a weird one. Struggling to do tasks sometimes that require mental effort over a long time, like a dissertation or a big paper or like a big project or cleaning the whole house or sorting all of the mail that you have piled up because that whole organization system failed. Losing things like a pencil, distraction, and I could keep going. If you're looking at the hyperactive stuff, it's more physical usually, or it's where people talk really quickly or their thoughts go faster than they can speak them, or struggling to physically relax and need to kind of wind down at the end of the day, struggling with interrupting, which is one of my personal things that I constantly work on, because interrupting is like, when I get excited about something, I just want to say it right away, and I have to like tell my brain to slow it down, but it's hard. But those symptoms, either way, have to be present at or before the person's 12. They have to be present not just at school or not just at home, but in 2 or more places that person exists, like work with friends or doing particular things. And then other things like anxiety or a personality disorder or autism spectrum disorder or a learning disorder aren't the reason for the symptoms that you're seeing. So that was a lot of information.
No, that's okay. So you said the symptoms have to be present before they're 12. So you cannot develop ADHD after you are 12? Or how does that work?
It's under the umbrella of what we call neurodiversity. And so neurodiversity includes things like ADHD, autism spectrum disorder. It includes things like dyslexia or, I forget the other, aphasia in its pure form, but that's kind of splitting hairs. But basically things that mean the way the brain works is different. It doesn't mean that it's not functional. It just means it doesn't function the way that society's norms expect it to, because of the rules that we've put together. So it's a thing that's usually present from fairly young. It's not something that you can get from political beliefs aside, that you can get from like an injection or a vaccine. It's not something you can get from being around someone with ADHD. You can't catch it.
Sure.
It's something that's present, but it might not be diagnosed for a long time. Like I was diagnosed as an adult during my grad school, and hey, Inkatak, I'm with you. I was diagnosed the final year of my doctoral grad program, and I went because I was like, I need help. I'm not doing the things that I need to do, and I'm checking all the boxes for the symptoms. And when we went back in the deep dive of like, what does early ADHD look like if we were to look at it before you're 12, there's a lot of boxes that I checked. Like, I've been in detention exactly one time. It was because I forgot a pencil 3 days in a row to my math class when we switched classrooms. So, I mean, it's like the signs are there.
Yeah.
Yeah, so I mean, it doesn't mean that you have to be diagnosed before you're 12, but often the symptoms are there, or the social function isn't expected of children as much as it is in adults.
Gotcha. So Fruits for Docs says, what advice do you have to help people with ADHD find methods to complete long-term projects?
It's almost as if he's doing a long-term project with me right now. So structure is really important. One of my favorite tips that I always land back on is to have your workspace and have it be sanctimonious. Make that place the place you do the work always. So nest into a little workspace, have it be bright, have it be comfy, have it be a place that you want to be, but also have extreme structure around it, which is probably an aggressive way of saying it. It doesn't have to be extreme, but have really good structure where like your cell phone isn't sitting in front of you so you don't accidentally open it. And you try to do physical cues to reinforce it. So like have the same cup of tea or have a beverage that you drink whenever you're sitting down to work. So you're cueing your body, kind of like when you go into a movie theater, the first thing most people think about is popcorn. That has been structured and conditioned into us as humans because they have shoved it in our face in every single way possible. You hear it, you see it, you smell it. Yeah. They advertise for it. They send you deals. So popcorn, you want this to be your popcorn, but work. Then social accountability is big tip too. This is why, even though sometimes people find it annoying, it's really helpful to post your run every day on Facebook, because it makes social accountability because people are going to see it. So even just telling someone, hey, I'm going to do something today, then they can check up on you later. Or even if they don't, you can just say, I don't want anything from you right now. I just want to tell you I'm doing the thing. It will give you a better chance of actually following through. And then chunking. So splitting it into little pieces and then giving yourself credit when you do those pieces.
Yeah, I know for me, posting and saying, well, I'm going to do this, it's like, all right, now whether anyone follows up or even if no one actually reads it or sees it, I feel like, well, I said I was going to do it, so now I have to do it.
That's it. Yep.
Yeah. So what are some common misconceptions about ADHD?
So common misconceptions are usually around children, usually around millennials, usually around like growing out of it. So with children, anytime that a child is hyper or has energy that they need to burn, clearly they have ADHD. And we'll say this about anybody. Like if someone is energetic, they automatically, like we will use it in casual language, like, oh, you're so ADHD right now. When in reality, expecting kids to sit in a classroom for how long is a really tough task because they're kids and their bodies are built to grow and play, and it's uncomfortable to sit still for that long, and they haven't been ground through that process long enough to tolerate it like we do as adults, I guess. with millennials, there was a big push to diagnose ADHD to make kids fit into that structure, and for a host of other reasons that I won't dive into. But the short story is there's a lot of people diagnosed with ADHD that might not necessarily have it, that might actually have autism spectrum disorder, that might have other things like anxiety. But the problem with that is not as much. I mean, overdiagnosing is no good. And then also medicating when a condition is not there is bad. So like stimulants are usually useful for just about everybody, and that's a problem because, like, other than the folks who basically feel like they're going to have a heart attack whenever they drink an energy drink or take a stimulant, like, stimulants can help other people focus even if they don't have ADHD. Mm-hmm. But I will tell you that they are immensely helpful on feeling more effective, able to focus, and motivated for folks who do have ADHD. And then for adults, a lot of people think that you grow out of it, which you don't. Sometimes you become more skillful and you learn how to manage it, or sometimes your ADHD symptoms don't matter. Like if you're a ski instructor, you're going to be really great at being on the ball and moving around and focusing on different things and juggling 8 things at a time. And or like if you're an artist and you can free flow, but then the accountability question comes up. So I mean, there's some trade-offs there, but usually ADHD transforms, it doesn't disappear because it's that neurodiversity bit again. So a lot of people think you grow out of it when you really don't.
I like that. It transforms, but it doesn't disappear. Link Attack asks, how are y'all dealing with the pandemic? Does it make ADHD symptoms worse, neutral, or better?
Oh, well, I think that's going to be a different answer for everybody ask. I would say that isolation for folks with ADHD, when it comes to like social accountability, work tasks, that kind of stuff, social accountability is a really key thing. Structure and routine are really big things. And so for myself, you are seeing the first video stream from my home. Normally I stream from my office, which is much more exciting to look at behind me. But because of the pandemic, I am here. And so it's going to be a bigger challenge to get work done when I am in my home and my dog's running around. You know, I can say hi to my wife and I can have lunch in my kitchen. My TV's right there. My PlayStation is right there. Viva Pinata's right there. But that's where having, again, those really rigid rules of like, okay, this is this chair. When I'm in this chair, I'm working. And so I know and have the skills to use that framework for myself, but I know that for a lot of folks, like, they don't have me in the back of their head, and not that I'm the only therapist that can do that for them, but like, it's a challenge, much like it's a challenge for many people to work from home. So I would say it depends, which is not the fun answer, but the true one.
Yeah, I think that's fair. And we actually had, so I mentioned to you earlier that we had a call with my work, and I work for an engineering company. It is not any sort of related to mental health whatsoever, but we do have a big focus on supporting mental health within our company, which is great from this giant engineering company. And one of the things that they talked about was trying to, you know, we say, if you can leave work at work, leave work at work. If you can, you know, leave home at home, leave home at home. But now everyone's working from home. And so one of the things that came up on the call was, you know, if you are having to work from home and you've never worked from home before, try to get, you know, that dedicated workspace and get where you have that workspace and you only do work there. And it's difficult. It is difficult. I don't have ADHD, and it's difficult for me to separate, like, all right, the kids are doing this stuff and I'm doing this stuff and I've got work, and it's hard. I think it's hard on everyone, but yeah.
That's accurate.
Yeah. So
also being in the epicenter in Seattle, it's kind of rough.
Yeah.
But
yeah, I have a friend who their office has been shut down for the past 2 weeks. And so I reached out to them and said, hey, how has that gone for you?
Oof. Yeah.
And they were like, yeah, not great.
Nope. The phrase I feel like I have on a broken record is travel insurance and secondary insurance, like Aflac. So if your job falls out from under you, you have some backup planning.
Yeah, no kidding. Travel insurance has been a big thing for a lot of people here. Hey, Frost. So how do executive function and ADHD interact?
So executive functioning is, let's see. Executive functioning is a function of the brain that includes 4 different tasks. These tasks are nonverbal working memory. So it's holding things in your brain, like a list of things. If I told you to clap your hands, touch your head, touch your knees, after 30 seconds, you have to hold those in your working memory to remember them and then use them. It also has to do with verbal working memory, like remembering people's names, which is my biggest kryptonite of ADHD. Like, I cannot remember names for the life of me. I could tell you someone's life story. I could tell you their face. I could look at them from a crowd and be like, yep, I talked to that person on a Tuesday when it was raining and they told me about their dog, but I couldn't tell you their name was Joe. But internalization of speech, so remembering and memorizing different words and phrases and things you need to remember. And then self-regulation of like how you come across to people, including your arousal state. So like fidgeting, bouncing, having a twitch, not like a tick, which is very different, and not like a stim, which is very different, which we'll get to later. And then also like interpersonal body language, nonverbal contact. And then finally, it has to do with planning and application of planning. So nonverbal working memory, verbal working memory, regulation, and planning. Now, those are an area of what we call deficit in ADHD in particular, where, as I pointed out with a name example, it's harder sometimes to do those tasks. It's harder sometimes to like have that interpersonal pause of waiting, even when you're really excited to tell someone something, to hold in and wait and hear about how they're doing first, if you're asking, or anything like that. So executive functioning is probably the brain area most impacted by ADHD, I would say.
Okay.
Yeah.
Hey guys, welcome on in. We're just talking about ADHD. If you have any questions for our guest, I'll just remind everybody you can put them in chat, you can put them in the queue, however you want to do that's fine. I am watching everything, so feel free to ask away. So are there other common conditions or diagnoses that can occur with ADHD?
Yes. So common conditions can include, in children, you'll see what are called conduct disorders. So it might be that children also struggle with how to respond in a skillful way to authority. You might see where there's just generally behavioral difficulties with kids learning how to regulate and be present in social situations. You might see learning disorders, you might see anxiety or depression, you might also see people be more clumsy and get like medical injuries more often. I know for me, like, I have so many bruises on my thighs at the level of my tables. It's absurd. There's no amount of like baby bumpering that I can do to my furniture anymore to make that not happen. So I'm just accepting it as my life. But that's what ends up happening there. So oftentimes you'll see anxiety and depression as more common, especially in adults, as co-occurring. You might also see autism spectrum disorder co-occur. And that's just more brain differences.
Yeah. So you mentioned kind of the authority, the issues with authority. Is that oppositional defiance disorder? Is that kind of what you're talking about there?
Yeah.
Is that something different? Okay.
Yep.
So,
ODD.
Oh, go ahead.
I'm trying to remember if there was another one besides ODD. Conduct disorder generally. So ODD is specifically for like authority, and then conduct disorder is more with like breaking rules, being aggressive,
Gotcha.
bullying. So it's not just with adults and authority, it's generally not being pleased with life.
Yeah. Fooster Jock asks, how does hyperfocus work with ADHD? As I've heard, that's a symptom. Can you explain that?
Oh, yeah. So I like to call it a rabbit hole. For those of you familiar with like Alice in Wonderland or even The Matrix, you go down the rabbit hole and you can get stuck, especially when you take stimulant medication. Sometimes you can get into that tangent. It doesn't quite look the same as for autism, where folks on autism spectrum who are diagnosed with autism spectrum disorder might have a deep passion for a topic and will continue to go back to that topic and know so many things about that. It's amazing. It's brilliant. And know all of the things about that topic and be all about it. And for young children, it's often about trains. It's also like Thomas the Tank Engine or vehicles, videos, that kind of stuff. But for ADHD, hyperfocus is more where you start something and you get into it and then you can't switch out of it. And so then it's like, if you pester that person, they might not even hear you. They might not even like nothing. Or they might struggle if you sit me down on a video game and I'm super into it, I'm into the lore, I'm into the process of it, and then it's time for dinner, I'll forget to eat for like hours. And it's not that I'm addicted to the video game. It's not that it's a problematic behavior, because like that very rare and not a very Saturday afternoon thing is that happening. But especially with meds and or generally when there's something interesting and satisfying, if that person lucks into it, they'll hyper focus sometimes, and then it's hard to get out. So it's kind of the opposite of it's part of it's hard to explain based on the language of it, but it's kind of part of that inattentive bit.
Yeah. Mental health and makeup said we always say the biggest danger to my second oldest daughter is my second oldest daughter. She's always thinking so far past where she's at physically. Yeah, that's. I have a niece who has a lot of bruises, and when she was a kid, like she's 13. Is she 14? No, she's almost 14. When she was a little kid, like she'd have so many bruises on her shins, and it was like, I don't even know where she got most of these, but you would watch her, and it's just like, watch her for 5 minutes and you'll see where she gets all of them. She ran into everything because she was already looking at something else. So it was just like, couldn't hold into her head what was there. So yeah,
that's it.
I hear you.
Well, because the thoughts are fast.
Oh yeah, they are. Especially for her. Like she has a fast, like it's just constant. You can tell just watching her do anything. You can tell that it's in there. Twice exceptional, gifted, and LD, such as ADHD, appears more frequently than we can recognize that my oldest son has autism and processing issues. Yeah.
You're right. Absolutely.
So what treatment methods are typically used for patients diagnosed with ADHD?
So the common ones are either CBT, which is cognitive behavioral therapy, or otherwise like behavior-based or like skills-based application. I have a really great workbook that I'll use with adults, and just kind of life hacks is the really casual way to put it, but like coming up with ways and structures and systems to help. Otherwise, medication, if you're talking about like ways it's classically treated. Medication, which are typically stimulants like Adderall, Ritalin, Concerta, Stratera, and then you'll also see the behavioral and cognitive component. So like changing thinking patterns and changing behaviors to create better habits.
Yeah. Mental health and makeup asks, let me get it to show up here. There we go. What's your favorite in the moment activity to help focus back in?
Ooh. Okay. So if I'm with someone else, or if the person is with someone else, having them explain it to the person that they're with. And then when we start teaching what we're doing, it's like, oh yeah, I know what I'm doing. I'm good. I can't tell you how many times I've asked for help with something because I just, like, in reality, I didn't realize it in the moment, but it was my ADHD kicking in, where I was like, too much, turning a molehill into a mountain. What do I do? Blah. Brain dysfunction. So then I asked a friend for help, and then they're like, okay, so what are you doing? So then I go to explain it, and I'm like, oh, well, this is what I need to do right now. And then you think through the logical order of things. Now, if you're not with other people, and I hope the specifier is none of this is therapy. I'm not your therapist.
Yes.
Awesome. None of this is clinical advice. This is just some skills-based ideas taken out of context and given. If you're alone, I would say do like a status check with yourself of like, okay, you can do environment check-ins of like, okay, I'm sitting here in this chair. How's my body temperature? Am I feeling warm? Am I feeling cold? What's distracting me? How do I put things in my way so I don't accidentally get on there? Like, it's so easy to grab your phone and be like, oh, Facebook, what's up? Like, the buttons clicks are in our brains so hard that it's like impossible to just derail that. So keeping your phone out of immediate reach, and so you have to like turn and use it. Or using a browser blocker if you're on computers. They have those all over the place. There's also apps. I, at one point, recommended someone to find a timer locking Tupperware. You can find it. It's there. That they could put their cell phone in until they finished their homework assignment, and then they could unlock it. So we timed how long it might take them to do that homework assignment, breaking it down bit by bit, and then putting it in there for that amount of time. So then they would either have to like completely ditch the activity and do something else until their phone became unlocked, or it was incentive to just focus in because the timer's counting down. And so you gamify it, you add some artificial pressure. So you find a way to not only filter into the activity that you're trying to do, but then you can also make it interesting, add some pressure, because part of it is that the like amount of pressure to build motivation and avoid procrastination is different than neurotypical folks. So you like, for example, the worst thing you can do often for someone with ADHD is be like, you can figure that out. You don't owe me a due date. You just do the project and bring it back when you're ready. Like, they're never like, it is so hard to do that and feel like there's pressure other than that person emailing you, be like, hey, how's the project going? And then the guilt kicks in and you're like, oh no, I have to do that. The deadlines are great. Structure is great. Breaking it down into edible pieces is great. And then gamify. So like, I bet that I can do 5 chores in 10 minutes. I'll be more likely to do those 5 chores than if I'm just like, well, I have to wash the floor and I have to do the dishes. It's like, how many things can I do in a particular amount of time? So it's just boosting the structure.
Yeah. Yeah. So Link Attack said the best treatment would be society changing to be more accepting and accessible to neurodiverse people. And I could not agree more. That's absolutely, that would be great.
Yeah. And I mean, sometimes it's literally just stepping away from what you're doing, having a drink of water, having a quick stretch, shake it off and go back in.
Yeah.
And remind yourself why the thing you're doing is important.
Yeah. Yeah. No kidding. I did go ahead and pop in an exclamation point diagnose, just repeating that, hey, we don't diagnose here, and encouraging if you,
it's impossible anyway.
Yeah. If you need something, to seek specific professional help for that. So, and then Foostra Doc said, I actually liked working around people. It actually helped with my accountability. That's awesome. Yeah.
It's a great one. Yeah. I behave much better at work when I have someone looking over my shoulder.
Yeah. Yeah, no kidding. Harder things first helps you. Yes. Lists are life. Lists. Yes. Hashtag lists are life. I love it.
Swallow the frog. Do the hard thing first.
Okay. So did you know, all right, Mark, this is my random fact that I don't know why it's in my head of the day. So Mark Twain is the one who said to eat your frog first.
Yep.
He also has a quote about procrastination saying it's something about why do today what you can put off, or why do tomorrow what you can put off until the day after tomorrow. Right. And I love that both of those are attributed to him. I think that's fantastic.
I wonder if Mark Twain had ADHD.
I have no idea, but it's interesting to me. So Foostra Doc also asks, how do you see adult ADHD compare and contrast with child ADHD?
Okay. So adults tend to lean towards the inattentive bit a bit harder. So you'll see a little bit more of that like organization, a little bit more of that like struggling for completion of tasks, struggling with like paying the bills on time or knowing what bills are due or remembering subscriptions you have going on. Because, I mean, let's face it, none of us do anymore. And then in kids, often we attribute a lot more to the hyperactivity, although that doesn't mean that that's what every kid has when they have ADHD. There's a bit more of a balance than that. But the inattentive can look like rabbit holes and struggling to pay attention socially or struggling and zoning out in class because something popped up. Yeah.
Yeah. I'm just loving the hashtag Lister Life. I think that's great.
Yeah. Oh, yeah. It's true.
Yeah.
I will plug shamelessly, not a sponsor, have no affiliation with this organization, but let me see if I can't find the link.
Yeah.
There's
go right ahead.
I think it's, where did I get that? I purchased this planner where it's split up into, it's an adventure, it's an RPG, but it's a journal. And you have the journey where you form a goal, and then you go through this book, and it guides you through, identifies your enemies like procrastination, stress. It helps you identify your allies. It helps you identify, like, oh gosh, if anyone can help me remember the name of this thing, I think it's the like, I purchased one and I just don't remember whatsoever. Oh man, kicking myself I didn't bring it with me.
Let's see.
I feel like my brain wants it to be adventure journal, but I don't think that's it.
See, now I'm Googling it too.
Hero's Journal. It's the Hero's Journal.
Ah, nice.
Yes. And I think it's so the cool thing is it's like a 90-day journal. So it's not built to be long. It's built to be effective. And it uses a lot of really cool concepts from psychology. Not that they are psychologists, and I don't believe that they built it to be a therapy tool, but it has a lot of the bones there that we use in something called acceptance and commitment therapy that helps reduce. Oh yeah, see, there you go, you found it. Yeah. You're so quick.
It's very cool. It says give your goal a quest. That's awesome.
Yes. That's it. And then you journey with them, and they acknowledge the stuff that gets in your way and help you focus back in and get on it. So I really like it.
That's very cool. I'm gonna have to check that one out too. That looks really neat.
Yes.
And it looks like something my daughter would love. Absolutely love.
It is child appropriate.
So I will, because I get planners and I lose them. So it's not going to be helpful for me because I just have to put it all into my phone, or I will never do it. But she loves to write things down, and she always carries a notebook with her, so that'll be really helpful for her. Do you have any tips that are specifically for gamers with ADHD?
I would say that in a social context, it's important to think about the role that the ADHD person wants to play or feels comfortable playing. Not that we should put them on blast and be like, you're going to be this person because that's what Dr. Sawyer said about ADHD. No, ask them what they want to do and see if there's a role they like. Like, I don't pick characters that are tanks, but I like to play like a tank. Mm-hmm. I like to get in the middle of the action and ask questions later, which is really hard to fix. Once you're in it,
does it need to be fixed? I mean, I think it just creates just creates new things to talk about later.
That's it. Well, once my character is far enough, I've developed, and I do accommodate with like the armor and the weapons and the strength to make it happen. But I think accommodating, especially if they get confused by the rules, or having them be the rule keeper, or like giving them tools and tactile things are really great to keep them on track. Like if you're playing a tabletop game like D&D, teach them how to use a gamer's journal. Teach them how to use the tools, the dice, the stuffs, get them invested in that bit. Have a really lovely tactile pen. Maybe use a smart pen so that if they forget what was going on, they can listen back instead of interrupting the whole crew. Just tools are always helpful, hands-on. Otherwise, I mean, if you're close enough friends with the person, or you are that person and you want to communicate to your friends, like, hey, let me know if I interrupt you too much. Like, I know this is a constant conversation we have on Thuppence of like, yo, we interrupted each other all the time. And given it's a very silly stream, so like that's part of the fun. But, or like if you have a friend who interrupting really bothers you, they might not realize they're even doing it. Like, for myself, that happens sometimes, and I feel terrible. So communication, consent, and tools.
Yeah. Now, I do also have to ask. Oh, not true. What's not true? What's a smart pen?
Oh, okay. So LiveScribe is an example of a smart pen. It's a pen that you have a special notebook and a special pen. The pen records the audio and synchronizes the audio to what you're writing, where you're writing it at the moment in time that you're writing it. So when you go really back, cool. You can, yeah, it's so cool. You can click on like a third through the math lecture and it will bring you back to the audio, a third through the math lecture when whatever was being said when you took that note. So that's it's really
amazing.
Helpful. Yeah. Yes. And they'll usually have things where you can upload it into a PDF because the pen knows it uploads it onto a PDF on your computer. Then you can just click it. They're super awesome.
That I wish that I had had that in school. That would have been amazingly helpful. Amazingly helpful. Like, that's just it. It just would have been amazingly helpful.
Yeah. Oh, for sure. And I think it depends on the context because sometimes, like, if you have a professor who speaks too fast or you're in a group that speaks too fast or something like that, it's the pen doesn't make any sense. But in the right context, it's absolutely invaluable.
Yeah. Well, this is not related to ADHD at all, but whenever I would take notes, like, it's the same thing whenever I type now. I can type everything that's said in a conversation. I can not miss a single word. But then after that conversation, I don't remember what I wrote or what I typed. Like, no, I have to go back and read it to figure it out. So I'm like, okay, wait, we've been talking for 30 minutes and I've been typing this whole time and I have no idea. But if I'm not typing or I'm not writing, then I can listen. But yeah, so that would have been helpful. Mental Health and Makeup says, I grew up in a house of ADHD and learned to anticipate what people were trying to say. I now don't even notice I'm doing it until someone is caught off guard by it. Yeah. Also, rainbow notes. Yes. Okay, seriously, best school decision I ever made. Thinking in colors just really helped the lectures. Keeping on task and not droning. If I know right, I don't remember it. And that's the beauty of, like, so many different people do things so many different ways, you know. So.
Yeah, meanwhile, I played a game called A Dark Room while I was in grad school, while I took notes and listened in class, because my brain there was too much space for activities. I was going to drift somewhere, so I played that game, and it is just enough stimulation for me to be able to keep track.
That is a fun little game.
It really is a fun game.
Yeah.
Is it still
mental
around? Health and makeup? Yes, very much so.
All right.
Mental health and makeup, you are a smart cookie, because not everybody can mind palette. That is a skill.
Are there any treatment methods that were used in the past that have proven to be not as effective now?
I feel like that's a tough one because research continuously leans towards therapy is better than no therapy. Some medications don't work for every person, and as time continues, medications get more effective and less bothersome with side effects. And there's always the trade-off of symptoms versus benefits. Like, a lot of folks on stimulant medications have trouble with eating enough and weight loss. Also, like, if you have any kind of heart problems, that could be a complication, and your medical provider would know better about how to guide you through those things. And so, like, I don't know that the methodology has changed all that much, other than there's less pressure to conform, and there's more open, how do we make this work, more accommodation. But CBT is one of the most classical treatment modalities that there is, other than, like, Freudian psychoanalysis and behaviorism too, but they're less shame oriented. So, like, one of the classical terms in cognitive behavioral therapy is thinking errors, and then we correct the thinking errors. So there's a lot of shaming language in that modality, but I mean, that's still there. We just don't call it face value. We just use it.
Yeah.
So not really, but kind of. Yeah. Yes, medications are less bothersome.
Yeah,
I don't know.
That's fair.
Depends on the person.
That's fair. Mental health and makeup. She said Mind Palace. Do you want to explain what Mind Palace is?
Oh, okay. So that's a pop culture reference to Sherlock. But mind palaces are where you choose. It's a memorizing technique where you can hold more information because you're creating a memorization tool. And so the classical way that it's taught is usually you think of a house, and in this house, you assign different rooms or different objects or different people or different colors or different like things you interact with. Say you're doing a house tour and you have to memorize all of these things for a test, and you have to remember 10 fruits. In the house we walk in, and the dining room is to our left and the kitchen's to our right. And I'm not going to do the whole thing, but just this first part. The dining room has a bowl on the table, and it's filled with bananas, which are our first fruit. Then we think about, okay, or like say you're memorizing presidents. So then that's, you could make something up like Abe Lincoln loved bananas. So bananas on the table. And then you think about the house tour, and you look to your left, and there's the dining room table with the bananas, and bananas are going to cue Abe Lincoln, etc. So it's kind of a inception thing, but it's a memorization technique. So if you color code like different flashcards, it's a much less elaborate version, but you know that, oh yeah, this is a purple one. What's the purple? Oh yeah. And then you can cue in to what the thing is.
Meanwhile, I'm going, okay, what room were the bananas in? Hang on. I do not have that. That is one skill that I do not have. I just don't have it. It's hard for me. Gamer Doc says Mind Palace is how I made it through med school. Yeah, there you go. Everything's color coded in my house.
Same Gamer Doc.
Yep.
Sean Way says, doctoral.
What do you guys think of the CIA's Project Looking Glass and the potential of psychic abilities? I'm gonna be honest, I don't know what that is.
I would concur. I have no idea. I mean, please hold while I Google.
You're right. I know. I'm doing the same thing. Project Looking Glass. I know. We need the little music.
All right. Operation Looking Glass? Airborne Command Control Center?
Let's see.
Or is this fiction?
I have a Looking Glass Spies General CIA records at cia.gov/library. But it's not really... Oh, it's got a whole PDF. Oh, boy. The Looking Glass Spies. This is a low-quality PDF that I cannot read. The Clandestine Mentality.
This is fancy.
Oh, man, I can't read that. I can't read that at all.
Can you give me the summary? Sean Way.
What are we talking about here with
Yeah.
Project Looking Glass? Now I'm gonna have to find this later. Oh, I see Operation Looking Glass that you were talking about.
That's what I'm looking at, but it's like not the same thing.
I don't know. That's okay. We'll hear back from Sean Way maybe and get it figured out. So as you mentioned in your introduction, you are very active across gaming communities. What drives that engagement in particular for you?
I love gaming. To put it simply, I like the gaming community a lot. I care about having a healthy environment, which is where my activities with Take This and Geeks Like Us and my collaboration goes. But also, like, generally, I love video games. I like thinking about the like social impact of video games. So I mean, some of it's just like general vested interest, and some of it's I like playing them. I like talking to people about them. So it just works well.
Nice. Yeah, that's totally fair. That's why I'm here.
Yeah.
I did have a community member submit a question beforehand. I don't know if she's here in chat, but Autumn says it seems new evidence is suggesting that ADHD and autism may actually be a part of the same spectrum. What are some significant ways in which they differ? And then for folks with both, is there a way to realistically distinguish which symptoms belong to which?
So for the first part, obviously, it depends person to person because each person's diagnostic explanation, their presentation, the fancy word we call it is manifestation, but basically like the way that someone's ADHD is, their neurodiversity is different. Even among people who only have pure and cut dry ADHD. Now, if we're talking about the difference between ADHD and autism spectrum, some symptoms overlap and some don't. So ADHD is more about this inattention, hyperactivity, impulsivity. You'll see people do things spontaneously, tire people out with their behaviors, and be really productive, and sometimes not in the most effective way, but sometimes it is. But it's mostly about self-regulation and that executive function stuff. Versus autism, where, I mean, there's a lot more of the social pieces there with autism that you won't necessarily see in ADHD, other than like the interrupty stuff. But autism, there's kind of this stopgap between understanding and engaging in social cues for a lot of folks. And also, like, I was picking apart the differences between like a passion for a person who is diagnosed with ASD versus like a rabbit hole for ADHD. So you'll see some things there that kind of overlap, some things that fully overlap, like executive functioning, both. Being stuck on an activity, both. But you won't see, I don't think I've ever heard of an ADHD person, I'm using very poor language around this, a person diagnosed with ADHD become nonverbal. I don't believe I've ever heard of that without autism spectrum disorder present. Mm-hmm. But I would also, and this is probably the less popular answer for the second part of like, if you have both diagnoses, do you distinguish? My challenge back would be, for what purpose? Like, I think that while like you can't conquer one and then the other, you can become more skillful in managing your neurodiversity. You can learn how to kind of like meet or evade or hack social cues that you need, and learn how your brain works to orient yourself towards success. But to a certain extent, like, your brain is your brain, and so you're dealing with your brain. And whether a table full of white guys decided in a book that one diagnosis fits that symptom versus the other, like it's about finding your way of success. So I would argue that like it's less important which diagnosis it comes from, and it's more important to know how to be successful as yourself and to feel satisfied with yourself as a human.
Yeah. I will remind everybody, we've been here for about an hour. Make sure that you've been drinking some water. Yes. And, you know, stretch your arms, stretch your legs if you need to, all that good stuff. So Mental Health and Makeup also has another question. She says, I have bipolar disorder, possibly ADD, probably ADD. How can you distinguish mania from the ADD spinning wheels?
Oof, that's a tough one. It depends. I know that's not the fun answer. ADD doesn't go away. I would wonder for folks, and this is not something that I have looked at clinically, that this is not something that I have sources behind what I'm saying. I have up to this point, but at this moment, I do not have a source in front of me. But my instincts and my base knowledge would lead me to wonder about like what stays and what doesn't, because bipolar is about seasons of condition. Like, when you're manic, some people are irritable and some people they feel on top of the world. Some people feel very angry. Some people feel really anxious. But, and so anxiety often gets misattributed to ADHD. And so that's where I would feel pulled towards looking into the symptoms and making a choice between like, is this anxiety? Is this mania? Is this ADHD? Is this drugs? Is this, what is this? Not to assume anyone does drugs, but I used to work in a treatment clinic, so the thought pops. Usually I just say, no, go away. We're not there. But sometimes, like, I had one person be like, I'm so anxious. My heart is always racing. And I was like, okay, let's talk about your diet. And they're like, yeah, I have 4 rock stars a day. And I was like, I think we found it. Yeah.
Say no more.
And then they smoked cigarettes, and it's like, that's it. That's the problem. We found it. We quit that, and then tell me what's up.
Yeah, we've talked a lot about being completely honest with your healthcare providers, from medical doctors to mental health doctors and like everyone in between that you should really be honest with what you do or don't do. You know, do you take your birth control 100% of the time? Do you take it 50% of the time? It makes a difference in what someone might prescribe you. So, and that goes for everything. But yeah, that's a lot of rock star.
Yes, it's too much.
Yes. I can drink
too much.
2 Red Bulls and I'm like pinging off the walls, but one is okay. But I just drink coffee. Probably too much coffee, but that's okay.
Just hydrating would have fixed some of that. Yeah, but I mean, again, also not a medical provider. But I mean, behaviorally, it makes sense to cut down on that because that just sounds uncomfortable.
Can you tell us a little bit more about the positive psychology book that you worked on?
Yes, it is the first ever positive psychology book related to video games. I'm super proud of it. I wrote chapter 4, which is about surprise, identity, exploration. And it is written by, it was a labor of love written by a group of dear friends and colleagues about the things that we're all interested in discussing and how they can be helpful, because oftentimes video games get discussed academically in a negative way, or like, what's the problem? Where's the thing? Which is a whole other topic that could take an hour.
Yes.
But in my chapter, I walk you through creating a Skyrim character that we named Scooper, and how you experience Scooper and how that might be an interesting journey for you. So I thought it was a lot of fun. I definitely took up as much effort as I could in writing it in a fun way that would make it interesting in the reader's eyes, rather than like, I can write really academically and dry and boring and use all the big words, or I can try and share information and make it interesting.
Yeah.
So I tried to make it interesting, but that, like, the whole book is really exciting in that way. So I highly encourage folks to check it out.
Yeah, absolutely. I did go ahead and put that link in particular again in there in case anybody's interested in it. Mental Health and Makeup said, my siblings were diagnosed with ADHD. I was never tested. Pretty sure I have the internal spinning, which can be overlooked in a house of chaos. Very true. Still working to properly label and understand my moods, but I know it's a process. Yeah.
Great doing the process.
Yeah.
That's hard work.
Booster Doc said, Sarah's incredible at making things relatable.
I try. I'm really good with analogies. One thing my ADHD brain is really good at is digging out really weird ways to describe stuff. So I just use it.
Makes it more memorable.
Do it.
Right? If it's super weird, then it's more memorable. Like, eat your frog first. Why would I know that's Mark Twain? Because it's so weird.
That's it. But we remember the weird stuff.
Yes. Yeah,
if you're having a hard time memorizing something on a test, all you have to do is say it in a weird voice, and then all of a sudden it's locked in there.
I like it. That's another good tip that I could have used in college. Dang it. All these tips now. It's okay. I will pass them on to my children, and they can do better than I did.
Yes. Yes.
So is there an overall well-being strategy you would recommend to anyone with or without an underlying disorder, non-related necessarily, but just an overall strategy?
Ooh, self-care. Always. Perpetually. Eat good food for you. Drink a lot of water. Wash your hands. If you need reminders, I tweet about it every single day. Take a deep breath. Focus on your body posture. Are you tense? What are you doing? When's the last time you stood up? When's the last time you ate a vegetable? Do a self-check. Take care of yourself. Get good sleep. Sleep has to do with everything else, especially mood. So get good sleep.
Yeah, so when I had the Doctors Kilmer on here, that was one of their things was their recommendation was to get some really good sleep. And then
yes.
They said, between 7 to 9 hours. And I went, oh, okay.
Yeah. Fun fact, human baseline is technically 5-ish hours, 5.5, 6. If you get below that, your brain starts to go into emergency shutdown mode. That's why Mania is really dangerous, because people can sleep 3 hours and feel rested. And it's like, no, you are not, friend. That is a military technique they used to use to torture people. Don't do that.
Well, and
sleep.
And here's another random fact that I just have in my brain. If you sleep for 4 nights in a row on less than 5 hours of sleep, it is the equivalent of a blood alcohol content of 0.06, which is like
Whoa.
3 drinks. It is like you have consistently had 3 drinks, and that's how you are until you get enough sleep. So there's that.
That's a lot.
It is
Yes. Although
a lot.
when you're making up sleep, you don't have to sleep the same amount. You can sleep less and make up more because you'll sleep deeper, faster.
Yeah.
That's why we often feel overtired once we've slept after not sleeping. But good sleep routines, self-care. Self-care is not selfish. You're right.
Yes, absolutely. Yeah. Struggle with too much sleep and still feeling exhausted.
It's hard.
Yeah. It's hard to find the balance. It's hard to find the right balance for your body because everyone's different. But then also, like I've been where if you get too little sleep for too long, not even 5 hours, just like 6 hours of sleep for too long, eventually you're either going to rest when you want to rest or your body's going to make you rest whenever it needs you to. So
yes, your body will start saying nope, quit, escape.
It will. If you could change one thing about mental health, the mental health field, or people's views of mental health professionals and educators, what would it be?
Oh, I don't know why, but well, I know why. It happened recently. But I was getting Comcast installed into my office because I was transitioning it from a different office in the same building. And the guy comes in and he puts it in my office. And he's like, so what do you do? Because if you look at my office, it's really weird because I have a bookshelf dividing the room in half. And on one half of the room is like a living room. It has a couch and a chair facing the couch with a coffee table and a rug and a credenza. And above the credenza is a TV because I'm a gaming therapist. And the other half is like office. It has a filing cabinet and bookshelf and my desk with my whole streaming rig set up and stuff and 2 monitors and whatever. And so it's a weird office to be in because it's not like a normal office, and I don't blame him for asking. But also, when I said I'm a therapist, he's like, oh, I better get out of here. And I was like, great, yeah, I'm definitely psychoanalyzing you, and I'm going to tell somebody. Like, I just want to people sometimes. Like, can I people when I'm not doing therapy work?
Yeah, no kidding.
But so I'm not here to determine all of the problems with your brain. I couldn't do that. I'm not psychic. I'm not like, I can't see your brain with an x-ray vision like Superman. So that would be one thing. And also, like, the brave thing is not to hide your feelings and swallow it. The brave thing is to express yourself.
Yeah.
And be vulnerable and be honest with people. So that's the other bit that I'd like to share.
Yeah. I think
Pretty cut and dry.
I think that's both really good things that I wish that, we could change as well. So I think that that's good.
Yeah. Bit by bit.
If there are any other questions that anybody has in the community, feel free to ask those ! Q or put in a queue, or honestly just put it in chat. Like, I'm watching you. I see you. I'm going to go ahead and post these links one more time. Lots of different places that you can check out our good guests here. And then I will just say, while we're waiting on people to type out their questions, is there anything else you'd like to throw out there that we didn't talk about, or about your work, or anything we didn't cover that you want to say?
Gosh.
Shout out?
I don't think so. Wash your hands. If you haven't washed your hands, wash your hands.
Yeah.
Social distancing is key.
Most definitely. I've been on my kids. Like, we're not even going anywhere. And I'm like, did you wash your hands?
When's the last time you washed your hands? Can you remember? Can't remember? Go do it. Like,
yeah. Well,
clean your house, wash your hands.
They gave the dog a bath today. And after they were done giving the dog a bath, they were doing something. I said, did you wash your hands after you washed the dog? And they go, no, because we used soap on the dog. I'm like, no, that is not good enough.
Also, soap, scrubba, 20 seconds or more. Hot water. Oh, man. Yeah. I feel like kids these days are probably going to be better hand washers than a lot of adults.
I'm sure that they will. And I go back because in 2009 or 2010 is when swine flu was, right? Yes. And so that is when I learned the whole sing yourself happy birthday twice, slowly, or the ABCs twice, and wash your hands for that long. And that stuck with me until now. And so I'm like, if I learned that as an adult, my kids are going to know it just intrinsically forever and ever and ever.
They're going to know it.
Yep. I hope so.
I also tell people if they don't want to sing a song or in their head, count to 40 because then that's probably 20 seconds.
Yes, true.
Or even just count to 60 and that's probably like 30 seconds of scrub.
Yeah. Yep. For some reason, I've been singing Love on Top by Beyonce while washing hands. Fooster Doc, I love it.
That's a good one.
That's great.
Good steady beat.
I Will Survive is another one.
Yes.
The chorus to I Will Survive is 20 seconds long, I think. There's a whole list of songs that's 20 seconds long. The chorus is 20 seconds long. I'll have to find that at some point and post it on Twitter. But so if you haven't checked out Dr. Sarah Sawyer, check her out at any of those links right there. And I will just say again that I appreciate you coming on here and sharing your time and sharing yourself with us.
Been a pleasure.
And chat, give me just a minute. I will be right back. I have been instructed to do a specific quest in RuneScape tonight for a friend. So I'm going to do that after this. But let me disconnect with our guest and I will be right back with you. I'll give you the cat cam because there is actually a cat right now.